Have you ever felt like you're just stuck in a health rut? You follow all the advice, you tried the latest diets, but nothing really seems to stick for the long run. It's super frustrating, right? Well, today, we're going to dive into a totally different approach that gets to the root of why that happens, and more importantly, how to fix it.
I mean, let's be real, we are just bombarded with health tips everywhere we look. You've got diet fads on social media, wellness trends. It's totally overwhelming. And half the time, the advice completely contradicts itself. It just creates this huge dilemma for anyone who's just trying to feel a little bit healthier. So, you gotta ask, right, why do so many of these diets fail us? And why does so much of the health advice we get feel like it's missing a huge piece of the puzzle? It's a feeling a lot of us share. And the answer, well, it lies somewhere you'd probably never expect. Turns out, the root of this whole problem isn't about your willpower or a lack of effort. It's actually a huge, often overlooked blind spot in the one system we're all taught to trust with our health. Think about it. When you've got a health issue, where's the first place you go? Your doctor's office, of course. We look to them as the experts on pretty much everything, from serious diseases to what we should be eating, and that makes perfect sense. But this is where we run straight into a critical gap in our healthcare system. Okay, now look at this number. Really let it sink in. Less than 1%. That's the percentage of time in most medical schools that's actually dedicated to nutrition education. To put that into perspective, across 4 entire years of intensive medical training, that's an average of just under 20 hours. It's wild. And that, right there, is the heart of the problem. Doctors are absolute experts at diagnosing diseases and prescribing treatments, no question. But with such a tiny amount of nutritional training, many of them just aren't equipped to give you that specific, practical, day-to-day dietary guidance that is so vital for managing and even preventing chronic health issues. So, what's the fix? Well, it's not about choosing between medicine or nutrition. It's about bringing them together. Let's take a look at an approach that bridges this exact gap. So on one side, you've got a physician. They're the expert in diagnosing what's wrong and figuring out the medical treatment. Then, on the other side, you have a registered dietitian, who's a specialist in medical nutrition therapy, basically creating personalized eating plans to manage your health. They are two totally distinct but equally vital skill sets. So what if you could have both of those experts in one person? That's exactly where Dr. Sumaiya's approach is such a game changer. By combining both of these roles, she brings this complete 360-degree view to a person's health, connecting the medical diagnoses directly to the nutritional solution. And when you look at her qualifications, it all just clicks into place. She's a BUMS physician, she's a registered dietitian, and a certified diabetes educator, all on top of more than 16 years of hands-on experience. This combination of deep medical knowledge and expert nutritional science, it's super rare, and it's the secret sauce to her incredible level of care. So all of this expertise flows into one core philosophy, and it's one that's simple but honestly pretty revolutionary in a world obsessed with quick-fix diets. It's not about starving yourself or restricting everything you love. It's about nourishing your body to feel good for the long haul. Her whole approach really stands on 4 key pillars. First, it's patient-centric, meaning every single plan is built around your specific medical history and your life. It's also non-restrictive, focusing on balance, not crazy calorie counting. It's culturally competent, using simple, home-cooked meals with ingredients you already have in your kitchen. And maybe most important of all, it's sustainable. This isn't some 30-day challenge. It's about building habits that actually stick. And this isn't just theory. You can see it in how it works for real people. Take Hina Sheikh, for instance. She absolutely loved that her plan didn't send her hunting for exotic, expensive ingredients. It just used what was already in her kitchen. This makes healthy eating practical, not just another chore on your to-do list. Or look at Suha Mariam, who discovered that the benefits go way beyond the number on a scale. Her skin started glowing, and she found the meals were super easy to make. It just goes to show that this approach is about boosting your overall well-being, making you feel great in your own skin, literally. But does this philosophy actually work in the real world? Well, the results, they kind of speak for themselves. And we're talking tens of thousands of lives that have been completely transformed. That's right, over 80,000 successful transformations. Let that sink in for a second. 80,000. This isn't a fluke or some new trend. It's a proven system that has been delivering real, lasting results for over 16 years. And these success stories aren't all the same either. They cover a huge range of health goals. Nisa Shaikh, for example, was able to lose weight and get her blood pressure under control, all through the online program, which is amazing because it shows this level of care is accessible no matter where you are. And then there's Syed Muzammal, who lost over 6 kilograms in just a couple of months. But you know what's more important? He regained his confidence. And that is huge. These are the kinds of real-world impacts that truly change lives. So you take all of those individual success stories, and they add up to this one incredible number, a 99% patient satisfaction rate. That's almost unheard of. It tells you that the method not only works, but that people feel genuinely supported and cared for every single step of the way. Okay, so we've seen the problem, we've seen this incredible solution, and we've seen the proof. So now what? Well, let's talk about how you can start your own transformation story. And getting started is designed to be super straightforward. First, you just pop over to the website to fill out a patient history form. Then, Dr. Sumaiya herself reviews it and sends you a free initial assessment by email. And from there, you're off, ready to begin your personalized journey to better health. And you know, everybody's needs are different, so there are different ways to get started. Whether you're just looking for a single consultation to get you on the right track, or you want more comprehensive support for things like weight loss or diabetes management, there's a path that's designed to be right for you. So we'll leave you with this one final thought. Now that you've seen the gap in traditional healthcare, and you've seen the power of an approach that brings it all together, the real question is, are you ready to finally make your health a priority with someone who truly understands the entire picture?